So
tell me your name and what grade you're in.
Okay, my name is Samya. I'm a junior in high school. So my question was, how did you decide to be a physician specifically? Like, did you hear from God again, or was that your own choice?
When God called me, He was calling me to be a physician.
Oh, okay.
Yeah. That was what the whole calling was, to be a physician.
Okay.
Any other questions?
So I'm a pediatrician.
Oh,
I'm just wondering, did you have time to pursue your hobbies or other things to help keep you centered, or like?
You mean while I was in med school?
Yeah.
Oh no.
And even during residency, like how did you keep it all together? Like,
I'm going to tell you, if you look at pictures of my son's, was it like his 4th or 5th birthday, where Chuck E. Cheese, you guys know Chuck E. Cheese, right? You see the pictures? You have all these kids screaming, yelling, jumping. I have all of my books at the table, studying. I just have to say very clearly that to get from failing algebra to straight A's and making really great scores took hours and hours and hours and hours and hours and hours of studying. Unfortunately, the Lord didn't just tell me the answers. That's what I was really praying for. Just show me which one to bubble in. No, I actually had to put in some really long hours. And I really became an expert at studying, where I would start in the morning. I have this very proactive setting. So you know how you can just read something and you kind of understand it, but if you close the book and say, okay, what did you just learn? You're like, wait, what? You know, you understand it, but you can't actually remember it. So I would study for 30 minutes, and at the top of the book, I would write questions of, you know, whatever I'm asking. I ask questions at the top, and then I'd take a 10-minute break, and then I'd come back in 10 minutes, and I'd answer all the questions at the top of the book to make sure that I really got it. Then I'd study for another 30 minutes, and I'd put all the questions, you know, at that paragraph, or those paragraphs were telling me, to make sure I got it. So I found that if I just read something, sure, I can understand it, but can I regurgitate it? You know, so I had to be very, very active. So 30 minutes of studying with my questions, 10-minute break to free your mind, go run around the block, go take a shower. So I would do 30, 10, 30, 10, 30, 10. Then my brain would start getting tired, and I'd start to do 20, 15. 20 minutes of studying, 15 minutes of break. And I would do that all day long. So by the time 6 o'clock came, I was so exhausted. And I knew I was ready to stop when I couldn't answer those questions when I came back from my break. I met my brain, it was on overload, and I'd have to take like an hour break. And then I'd come back to it. And being a pastor's wife, we entertained all the time. And so we'd be entertaining, and I'd go right upstairs. I'd say, okay, I'll see you guys in 30 minutes. Okay, I'll see you on my break. And my church understood. They knew what I was doing. I would go upstairs and study, and then I'd be so excited I'd get to come down for 15 minutes for the break. I'd come down, we'd play cards, we'd have fun, then I'd go back upstairs for 30 minutes. But that's how my life was. You know, I'm not one of these geniuses that just gets it all the first time. I had to rehearse it and make sure I knew it and ask it 3 different ways. So that's how I did it. And no, I did not have any hobbies. I didn't watch any television. I didn't go to any movies. I didn't do any of that stuff. I was 100% all in, striving for 100% on every single test. And because I'm someone who makes careless errors, unfortunately, you know, have you ever taken a test and you walk away and you're like, oh, that was stupid. I can't believe I did that. Like you knew the right answer, but you put something stupid anyway? That's me. So I always had to study to make sure I knew 100% of the material, because I knew I would make 5% stupid, careless, ridiculous errors. So I had to overstudy. I had to overstudy. Any other questions? Sure. Tell me your name and what grade?
My name's Tal, and I'm in 11th grade.
11th grade.
Yeah. I was just wondering, like, what did you think of, like, what was your image of, like, a doctor before you, like, became a doctor versus, like, once you actually became a doctor? Like, what did you think being a doctor was going to be like, and then what is it versus what it actually is like?
That's a very good question. Because I remember when I had to go to the emergency room with someone, and I used to see those emergency room doctors sitting around talking and laughing, and you have all these people waiting, and I'd be like, get to work, buddy, you know? What's going on here? I see people talking and laughing behind there, and I see all these people in the rooms, and I'm thinking, what are they possibly doing? So in my mind, I had no real conception of what a doctor did, really. I mean, I knew they took care of sick people, but I wasn't really a sick child growing up, so I didn't have that kind of story to relate to. I just knew that they were esteemed in the community as being these great people, and they were super, super, super smart, and they could figure out what was the matter with you. I think what I found was, you know, the medicine, the actual knowledge base that you need to have to take care of people, honestly, I think is not the least of what you need to know, but the most important thing, I think, which I didn't realize, is your ability to communicate with people. You know, I mean, when I started reading that only 15% of people who are on high blood pressure medicine pills actually take their medicine every day, I was shocked. I'm like, if you have high blood pressure, don't you take your pills? No. People miss pills all the time. They say, oh, I feel okay, I'm not gonna take it. It's all about your ability to convey. And you know, there was another study that talked about how the patients who took their medicines were the ones who felt their doctor cared about them. Not if it made sense to take it, if it was for your, you know, we show that it can save your life. No. Does my doctor care about me? That's who takes the medicine. And so then I started to say, wow, I really do care about my patients. You know, it's just part of, I feel like I'm doing God's work. So I really invest time in trying to develop a relationship with every person who I come in contact with. So to me, being a good doctor is not just knowing the medicine. I mean, really and truly, you guys could Google exactly how to take care of people. If I gave you a diagnosis, you could Google it and figure out the best way to do it. You really, truly could. It's not a big mystery. It's not rocket science. You don't need calculus to practice medicine. You really don't. I mean, I think calculus is because they were trying to weed out the rugrats, you know, weed out the riffraff. You know, they're trying to say, how committed are you to this thing? That's what it's really about, I think. I think you have to have some critical thinking. You have to be able to get a whole bunch of facts and put it together into a cohesive diagnosis. And you have to really, to me, to be a good doctor, you have to really care about the person in front of you. And that's hard to do over and over and over and over again all day long when you're tired and hungry and stuff is going on in your own life. Any other questions? Sure.
I'm wondering, how do you decide on your specialty and what point that the light bulb just go off? You say, this is what I want to do.
Well, that's a funny question because when you're in med school, you do different rotations. You guys know about that, right? You do like a little pediatrics, a little surgery, a little this, a little dermatology, so you can kind of see what you want to do. Then once you're in residency, I chose to go the medical route instead of the surgical route because the surgeons are in the operating room all day and there's no lights. I couldn't do that, so I did the medical route. And one of the rotations that you do is the intensive care unit. Do you guys know what the intensive care unit is? That's where the sick people, you know, they don't talk to you because they have the breathing machine on and they're sick. They're at death's door. So I had to do this ICU rotation at Tufts Medical Center, what we call our mothership. Can I tell you, intimidating, scary, crazy? I mean, every room you walk into, all you see are tubes and lights and beep, 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 and people running around and shocking. And so what happens is you go on rounds, and you're supposed to go in the morning and see your patient, find out their vitals, what happened overnight. You're supposed to present their whole case, and then you tell what your plan is. Oh my gosh, I'm standing there with this woman. She's written all these papers. She's published. She's like a big shot. I'm literally shaking in my boots, okay? I completely fluff it. I mean, I couldn't remember the vitals, I got the wrong diagnosis, my plan was horrible. I felt terrible. And I remember calling my mother and my stepdad at that time, that night when I got home, and I was like, Mother, I cannot believe how I messed this up. I mean, I am doing horribly. And I said, God called me to do this work, and I can't function. I'm just so nervous and so anxious and so scared, and I'm doing a poor job, and someone's life is going to depend on me at one of these days. If I don't have my resident to cover for me or my attending, these patients are in trouble. So she and my stepdad, they prayed immediately. Okay. The funny thing about your question is, when I finished residency, I ran the intensive care unit for 5 years. That is the irony of your question. Because the one thing that I thought was the most horribly scary, I'm thinking, give me something easy where there's no emergency. Give me dermatology. Give me something easy. There's no emergencies in dermatology, but there's only a few emergencies. But look at what God does. It's like the thing you think is impossible, that you can't do, you're so scared to death. That's the thing that I had the strongest. All of my test scores were the strongest in intensive care medicine. So funny. So there was an opening. You're not supposed to run an intensive care unit straight out of residency, okay? You're supposed to do a critical care fellowship where you're trained in doing intensive care medicine. But there's not enough critical care specialists to staff all the intensive care units in the country. So then you have people like me who are not qualified running an intensive care unit, okay? People crazy enough like me to take on that job. Now, let me just tell you how miraculous it is. So my community was part of the job that I had was part of 3 hospitals. And what they did is someone did a study looking at the mortality rates, which means, do you guys know what mortality rates are? Death rates, right? Of people in intensive care units at all 3 hospitals. Well, no one told me they were doing the mortality, because obviously they're comparing me because the other 2 hospitals had critical care specialists. I was the only one who was running an ICU, not being a critical care specialist. So after the study was done, I had no idea what was going on. I guess because it was blinded, I don't know. But anyway, blinded means, you guys know what blinded means? Where they do a study and they don't tell the people that they're studying them so that you can't budget or mess up the results. Turns out that the lowest mortality was in my ICU.
Woohoo!
Crazy. Really? I mean, all I can tell you, I just have example after example. If you really, it's just an example of how God can really use you if you're just willing to be obedient and like put yourself out there and make a mistake and just know God's going to catch you because you're doing the best you absolutely can do.
So did it take a special effort for you to get yourself more aware of what a critical, critical care unit physician would need to do? Because that's probably another learning curve, right? So
You better believe it. I feel like my mother called me a professional student because, I feel like my whole life is studying, constantly studying. Because being critical care, it's a whole new, how do you manage? Okay, you're putting a tube down someone, you're forcing air into their lungs because they can't breathe in and out on their own. Well, how do you know how much air to put in? What if you put in too much air? The lungs could pop. If you don't put in enough air, they suffocate. Then if there's infection in there, do you put in more air or less air? And if the lungs are stiff because they're smokers, then how much air do you put in? And so all of these things are sort of the nuances of medicine that you just have to practice, you have to learn, you try this a little bit. You call your friend and say, I tried this didn't work, what do you try? Well, I don't know, let me call and you're up all night long and you can't sleep because you're worried about, did I put in too much air or did I not put in enough air? And that's what my life was like for 5 years. 5 years. Yeah, it's a lot of work, a lot of responsibility. Yes.
How long did it take you from the beginning of your, like, the time you started undergrad to when you started working in critical care?
So let's see, I was in Arkansas. As soon as I heard God say that, I gave a reasonable notice to my job because I was teaching, so I said I would finish out the semester, and then the next semester I went to school. Then I had to do all my undergraduate stuff. I think that took maybe a year, because I took 5 classes each semester, and then I think it was like a year and a half to do all my medical prerequisites. I ended up taking the MCATs before I took organic chemistry because I didn't have time in the summer to take organic chemistry. And so I had to teach myself organic chemistry, which is crazy. It's really, I don't know. But anyway, so I took this little MCAT prep course in the summer instead of taking organic chemistry, so then I took the MCATs. So it just all, and then I applied, and then I started school, and 4 years of med school, and then 3 years of residency. So it all happened, right? I didn't let any time, because I was already older. I mean, I was like one of the older people in school. I was 20, I think I was like 26 maybe when I started med school. And most other people were like 22. So I was one of the older ones, and it was different, yes?
And also, like, what would you say was your greatest challenge when balancing family life and being a student?
I think the greatest challenge, when I started off, I was telling you, I was really trying to make my life as easy as possible. I wanted to have a life where I worked banker's hours, 10 to 2. I used to watch the soap operas, Young and the Restless. I used to put my schedule my college courses around Young and the Restless. Okay? From 11 to 12, no classes. This was my framework. Okay? This is how far God brought me from, I'm telling you. It was a very long distance from. It's all about me relaxing, enjoying, getting my nails done. I wanted to have the cutest hairdo. All of that was important to me too. Okay, I took a bath yesterday. That should work for the next 2 or 3 days. Yeah, I think the biggest challenge was giving up free time and fun time. That was the biggest challenge. I really love my free time a lot. And to give that up was the hardest thing for me. I didn't really have much because any so-called free time I have would be what I call study break. And that's when I spend time with my son. Yes.
How did it go for the first 4 years in med school for these kids to know, yeah, you've done undergraduate and you've done biology, chemistry major, whatever, but after that, what happens in the first 4 years when you are in the med school?
Med school, okay, so the first year is basic sciences, biochemistry, physiology. If you were a sciencey person, this will all be review, I suspect. I didn't take all of this stuff before med school. I just took what they made me take, which was biology, chemistry, organic chemistry, calculus, physics. All the other stuff, I figured I'd wing it once I got in there. But when I was in med school, a lot of other people, they were like, oh yeah, I took biochem in undergrad, I took this in physiology, I took that already. They're sailing through it. And I'm learning about all this stuff for the first time. I'm like, wow, this stuff is amazing, wow. Microbiology, how the little bugs work, all of that stuff. If you take biology as an undergraduate, you're gonna already have known this. When you get to your first year of med school, it'll be nice for you. You won't have to study as hard as I will, I'm sure, because it'll be a second time. So that's the first 2 years. So the first year we did the way things are supposed to work in your body, physiology, how your heart is supposed to work, how your lungs are supposed to work. Then the second year, we did the pathophysiology, what happens when it breaks down. So 1 year of how the body is supposed to work when it's healthy, and then the second year, what happens to all those same areas when your body breaks down. And then the third year is when you're actually out into the clinic seeing your first patients as a third-year med student, not knowing anything. And then fourth year, you know a teeny bit more. And that's when so you do your clinicals, that's when you do your rotations, all your different fields, to try to figure out what kind of doctor you want to be. Dermatology, cardiology, pulmonology, renal, which is kidney, lungs, pulmonary, all of these things you do, and then you say, I kind of like this. And then when you go to apply for residency, something really caught on. I knew I would never be a pediatrician, I bow to you, because a little sick kid, oh my gosh, my heart would break. I couldn't sleep at night, oh, the poor baby. I just knew I couldn't do it. I could not do it. If someone is 90 years old and they're dying, it makes sense to me. I can make that make sense in my mind. There is a time for everyone to die. But when a 6-year-old dies, I'm just not made out of that material to be able to handle that. So I thank God for you. Okay, that's hard. That's harder work that I'm able to do. So that's what med school is. The first year, how the body is supposed to work. The second year, the way when it breaks down. And the third year, you're doing your rotations to see what kind of doctor you want to be. And then your fourth year, you've kind of figured out what kind of doctor you want to be. So then you do a little bit more of that type. I think I want to be an internal medicine, a cardiologist. So let me do a couple of cardiology rotations. And then when you go to apply for residency, you can say, oh yes, I did this extra cardiology rotation. I really want to do it. Please accept me. Yes.
I just have a comment. So you went into this feeling weak in math.
Mm-hmm.
However, you went into specialize in ICU, which has the most math ever of all the residencies. I have a similar situation where my first rotation as a resident was neonatal ICU. And I'm weak in math, but at the end of it all, they were asking me if I wanted to do a fellowship in neonatal ICU. So yeah,
So you had a
interesting.
similar
Yeah, my weakest point with math became something I really excelled at later on as far as specialties. So
Yeah, so maybe it's ironic.
yeah, it is.
So
Didn't
ironic.
expect that.
The thing that scares you, the thing that you think you can't do, is the thing you become a specialist in. Any other questions? Yes.
Can you tell us about a case you had, one interesting case where a patient came in and how you diagnose and choose a treatment plan and just the process?
Sure. I think what's unique about me as a physician, I always try to figure out why God called me into medicine. Like, there's so many smart people in math and science. Why choose someone you have to do all this work on, Why not pick someone who it comes so easy? But I think one thing that's unique about me that maybe God has been able to use is that I don't have a real sense of respecting artificial people-defined rights and wrongs, okay? I don't have any problem going against authority. I guess I should say it that way. If I know I'm right about something, or if I feel right about something, oh, thank you so much. I think I'm a very strong patient advocate. I think that's one thing that makes me unique among many of my colleagues. I think when you get into any field, you kind of want to look good amongst your colleagues. You want to feel highly esteemed, like you're a good doctor. It's one thing if a patient says you're a good doctor, but it means a whole lot more if another colleague really feels you're a good doctor. So I think that in a lot of ways makes doctors do or not do certain things because you want to be esteemed highly among your colleagues. And so getting to your question about a case, okay? So if you guys haven't noticed, I'm a Black woman. And there's this condition called sickle cell. Has anyone heard of it? Yeah. Okay, so sickle cell. And it's a condition that mostly affects Blacks. It affects some others, but mostly it's Blacks. And it's this condition where the red blood cells, which look like little donuts usually, are kind of squeezed together, and they're in a shape of a little bit, so like if a regular red blood cell looks like this, a sickled cell looks a little bit like this. And so when they go through your arteries, they're kind of squished up because a red blood cell, you know, if they're circles, only so many can go through. But if they're sickled, more red blood cells can get into a smaller area. And so what ends up happening is the blood flow becomes sluggish. And if the blood flow becomes sluggish, you can actually have death to cells and bones in your body because the little cells can't get through very easily. And it causes something called a pain crisis, which means, you know how you've heard of a heart attack, right? Death to the heart muscle. Well, imagine having a heart attack or death to a bone. It really hurts, you know, I mean, it really hurts. It's like death to a part of your bone. So sickle cell patients get these things called pain crises. And they are super duper painful. I mean, it's like someone stopped the blood supply to a particular part of your body. And there's a lot of literature that sickle cell patients, which are by and large all black, do not get adequate pain control. Because the doctor is always trying to decide, are you really in pain or are you just wanting some narcotics? Because narcotics are addictive. And so the doctor's trying to decide, do you really need it because you're in pain? Or are you trying to sucker me into giving you a drug that you really shouldn't be getting? You're really just an addict. So this is the big controversy with sickle cell. Is this person really in pain? In which case you should certainly give a narcotic to help with the pain. Or if they're trying to sucker you, be smart, hold off. They're not really in pain. So the question is, how do you tell if someone's in pain? How do you know? If I take a big hammer and hit you, well then you can see a bruise and you know you're in pain. But if it's in the bone, how do you know? How do I know if she's lying? She's not really in pain. You see, so this is the big question. Does anybody know how we can tell as doctors if someone's in pain if you can't just look at it? I'm just curious. Do you guys have any idea how we think about it? Sure.
I'm not sure, but does it have something to do with like it touching a nerve or something?
Yeah, if it touches a nerve, it will certainly hurt, but the problem is we won't be able to see that. I mean, if you do an MRI, you can see that nerve being crunched or squeezed. That's true, but if there's a bone that's damaged, you know, how are we going to know about a bone? Can you tell by looking at someone if they're in pain? Can someone fake that? Sure.
Maybe your heart rate goes up when you're
Oh, that's a very good one. That's an excellent one. Usually, if you're in pain, like if I take her and I get a hammer and I hit her head and I hit her leg, her heart rate's going to go super fast. And that's part of the vital signs. And then another part of the vital signs, does anybody know what else goes up when you're in pain? Blood pressure. Who said it? Blood pressure. That's right. Okay. So, we're on rounds. Here's my black patient who's having a sickle pain crisis, and her concern was that she wanted more pain medication because she said her pain is still an 8 out of 10. I think she was on 1 milligram of Dilaudid, which is a narcotic, and 1 milligram per hour of Dilaudid. And so I was looking at her vital signs. They were perfect. I mean, her blood pressure was lower than mine, her heart rate was definitely lower than mine. And I was like, wow, that's funny. But when I went in to see her, I was so moved by her story. Like, I could tell she was in pain. And this is one thing that doctors do, is that after you leave the room, you kind of look after they're not looking to see if they're still acting as in pain as they were when they were talking to you. And I looked around the corner, she didn't see me. She was really writhing in bed and rubbing her leg and the same way she was doing when I was in the room. And she didn't see me. So I said, this is a disconnect. Her heart rate's good, her BP is good, her blood pressure's good, and she's obviously in pain. I can see this woman in pain. I don't understand this. So I go to rounds, and I present this data. I said, you know what? Her heart rate's okay, her blood pressure's okay, but I really believe her that she's in pain. And I explained what happened. I looked around the corner, she was still writhing in pain, and the attending said, drug seeking, no more pain meds, and moved on to the next room. So I was furious. I was so furious. I'm like, this is my patient. I know I'm only an intern, but this is my patient. Intern is your first year of residency. And I take it very seriously. At this point, I'm a doctor. I said the patient is in pain and needed more pain meds, and I refused to just have his dismissive comment of drug seeking, moving on to the next patient. No explanation, no discussion, drug seeking, next patient. So I said, how do you fight something like this? Here is big time attending, professor, been a doctor for, some odd years. Here I am, little peewee, just got here. So I said, you know what? I'm gonna fight fire with fire. So the next day, so now I'm used to studying, right? Like I'm a champion studier. So I stayed up all night long in the library, researching, is it possible to be in pain and have normal vital signs? Because that was his argument, that her blood pressure's okay, her heart rate's okay, she's not in pain. Okay, so I said, okay, well, guess what? There is a whole body of knowledge, a whole body of clinical knowledge, and they did studies on people who had sickle cell and found out, they did the internal calculations by looking at the damaged bone, and they correlated the pain scores with the bone being infarcted or dead, and they were able to find that once you've been in pain for a long time, your heart rate and your blood pressure does not go up every time. The first few times it goes up, but after a while, your body can't mount the same heart rate and blood pressure over and over again. So that next day, I came to rounds, and I have to be very careful because it's all about relationships in everything you do. If I were to just come on as the new kid on the block and I have all the answers, who cares if I have my evidence? And I had 3 papers ready to present that I had memorized all the data on. But I had to be very sensitive because this was a white male, dominant in his role. All right, here I am, a black female advocating for another black female, and I know those dynamics. And so I had to be very submissive and very humble, but also very firm and advocating. And I said, Dr. So-and-so, thank you so much for your for helping me with this case. I really would like to once again advocate on behalf of Miss So-and-so. And I said, I wonder what you think about this data that I have, and I wonder if we can give it a trial to see if we can increase it, because it also gave some methods to increase the dilator in a way that would be safe and effective. I said, I wonder, because I know you to be a man of evidence-based knowledge. See, stroke them a little bit, build the ego up. I said, so I wonder if it would be okay with you, because it was going to have to be okay with him, okay? To increase the dilator in this way that this study shows. It's right in line with what you've been teaching me about evidence-based medicine. You see, so I didn't come in like I'm coming up with this great idea. No, no, no. It's you, oh great doctor, who came up with the idea. I'm just using what you've taught me to implement it in this situation. And so in doing that, using those skills of diplomacy, I got my patient the medicine that she needed. And she was so grateful to have a pain score of 4 instead of 8. And so that's what I do. I advocate, and I'm trying to be sensitive to the people around me as well. Is that right?
That's wonderful. Okay. Yeah, thank you so much. We're not going to clap. We're clapping because there's some sensitivity towards clapping in the group. We're all going to